going to start with the symptomatic terms. So the first one for symptomatic terms for Chapter 7 of the endocrine system. Number 1, exophthalmos, which is a protrusion of one or both eyeballs, often caused because of thyroid dysfunction or a tumor behind the eyeball. Exophthalmos. Number 2, glucosuria. Glucosuria, which is glucose in the urine. Number 3, hirsutism. Hirsutism, which is shaggy and excessive growth of hair, especially in unusual places. Hirsutism. Number 4 is hypercalcemia. Hypercalcemia, an abnormally high level of calcium in the blood. Number 5 is hypocalcemia. Hypocalcemia, which is an abnormally low level of calcium in the blood. Number 6 is hyperglycemia. Hyperglycemia, an abnormally high level of glucose in the blood. Number 7 is hypoglycemia, which is an abnormally low level of glucose in the blood. Number 8 is hyperkalemia. Hyperkalemia, an abnormally high level of potassium in the blood. Reminder that kalium means potassium. Number 9 is hypokalemia. Hypokalemia, which is a deficient level of potassium in the blood. Number 9 is hypersecretion, which is an abnormally increased secretion. And 10 is hyposecretion, which is a abnormally decreased secretion. Number 11 is polydipsia, excessive thirst. Polydipsia. Polyuria is an excessive urination. Polyuria. That was number 12. Okay, now for Chapter 8 concerning the blood and lymphatic system. Number 1, AIDS. Also, the acquired immunodeficiency syndrome. The acquired immunodeficiency syndrome. It is a syndrome caused by the human immunodeficiency virus, HIV, that renders immune cells ineffective, permitting opportunistic infections, malignancies, and neurological diseases to develop. Acquired immunodeficiency syndrome. Number 2 is anemia, which is a condition of reduced numbers of red blood cells, hemoglobin, or packed red blood cells in the blood, resulting in a diminished ability of red blood cells to transport oxygen to the tissues. Oh, by the way, these are the diagnostic terms on Chapter 8. So that one was anemia, diminished ability to transport oxygen from the red blood cells to the tissues. Number 3 is aplastic anemia. Aplastic anemia, which is a normochromic type of anemia characterized by the failure of bone marrow to produce red blood cells. The bone marrow cannot produce red blood cells. Aplastic anemia. Number 4 is iron deficiency anemia. Iron deficiency anemia, which is a microcytic and hypochromic type of anemia characterized by lack of iron that affects the production of hemoglobin and is characterized by small red blood cells containing low amounts of hemoglobin. Iron deficiency anemia. Low blood, low amounts of hemoglobin. Number 5 is pernicious anemia. Pernicious anemia, a macrocytic normochromic type of anemia characterized by an inadequate supply of B12, causing red blood cells to become large, varied in shape, and reduced in number. Pernicious anemia, lack of vitamin B12. Number 6, autoimmune disease. Any disorder characterized by abnormal function of the immune system that causes the body to produce antibodies against itself, resulting in tissue destruction or a loss of function. Autoimmune disease. Number 7, erythroblastosis fetalis. Erythroblastosis fetalis, which is a disorder that results from the incompatibility of a fetus with Rh-positive blood and a mother with Rh-negative blood, causing red blood cells destruction in the fetus. A blood transfusion would be necessary to save the fetus. That was 7. Number 8 is Rh factor. Rh factor, which is the antigen on the surface of red blood cells of the Rh blood group system. Its presence can cause a reaction between Rh positive and Rh negative blood. Rh is derived from rhesus monkey, in which the antigen was first observed. Number 9 is Rh positive, which is the presence of antigens. Number 10 is Rh negative, which is the absence of antigens. 11 is hemochromatosis, which is a hereditary disorder with an excessive buildup of iron deposits in the body. Number 12 is hemophilia, which is a group of hereditary bleeding disorders caused by a defect in clotting factors necessary for the coagulation of the blood. Hemophilia. Alrighty, that's it.